Alright, so the last section in our presentation is actually Matt's section, which I'm going to do for him since he doesn't have a voice at the moment. And it's on call center troubles, which is a focus on a case study. So pretty much the topic focuses on health issues in call center environments, and some of these include sleep disorders, which are long hours and few breaks that cause call center employees to become highly susceptible and to sleeping disorders. Depression. With little room for advancement and diversity in call center work, employees can fall into a state of depression. Eyesight problems with few breaks and continuous fixation on computers. Many of the employees can become easy victims of eyesight conditions. Just a continuation on some of the health risks involved in call centers. Ear problems. While being in the constant voice-to-voice conversations with clients via headsets, call center employees are at a high risk of receiving ear problems in the future. Digestive problems. There's little room for diversity in the workplace for meals, as well as continuous catering from outside food services, so the call center employees may become highly susceptible to digestive problems. And lastly, voice loss. With constant use of their voice being a primary function in the call center work, it's no surprise that they're at a high risk of losing it. So some of the other issues that affect call center workers include high employee turnover, and this deals with the being involved in a high or low-skilled job. There's no wonder that there's an excessive amount of employee loss in hiring in call centers. Career opportunities. There's a pretty flat hierarchy involved in this workforce, and so it's very difficult to advance in these types of jobs. And lastly, factory type work. Call center employees have stressed that they feel as though they are just a small stationary piece of machinery being used in the makeup of a larger company. So before we conclude, this is just one last point that deals with female discrimination, and it's just a case that we've focused on. It deals with a pregnant female call center worker who is actually decked a percentage of her pay for taking too many bathroom breaks during her shift. And the link just here on the slideshow shows the further information on the article if you want to read up on it. And it goes on to say that there's little room for pregnant women to become call center managers, for their maternity leave causes the company to rehire somebody else, as well not ensuring them of their job when they are able to return. So there's really low return rates. So to conclude our presentation, we have two discussion questions that we wanted to present to the class. The first one focuses on, do you think that some jobs are better suited for women? Do you agree or disagree with these gender stereotypes, and why? And secondly, when dealing with call center agents, do you prefer to deal with someone of your own gender?